Welcome to our channel Physioworld. Today's video we're going to talk about contracture and properties of tissue. So now we're going to start with the definition of contracture. What is contracture? So contracture is the adaptive shortening of a muscle tendon unit and the tissues that surround a joint. Now what are the tissues that surround a joint? This include ligaments and tendons. So contracture usually limits in range of motion. Now, as we said in our previous video, range of motion is defined as the movement of a joint measured in degrees. We have four types of contractures. We have myostatic, pseudomyostatic, and arthrogenic and fibrotic contracture. Myostatic contracture refers to the reduction of the number of sarcomere. Now, what are sarcomere? Sarcomere are basic muscle contractile unit of a muscle fiber. Now, these are basically the fibers that help a muscle shorten. If they decrease in size, the muscle length will also decrease and therefore causing a contracture. However, myostatic contracture is resolved with a little bit of passive and active stretching.
Arthrogenic contracture, it is also called as periarticular contracture. It may be caused due to intra-articular pathology. In the bone, there may be changes like having adhesion formation, synovial proliferation, or joint effusion. Between the joints, there will be a restricted range of motion and they may also lose mobility. Now, pseudomyostatic contracture. In this type of contracture, it will result into hypertonicity, that is the causing of spasticity or rigidity. It will be associated with central nervous system lesions like the cerebral vascular accident or a spinal cord injury or any traumatic cause brain injury. This may be due to even muscle spasm. In pseudomyostatic contracture, we give stretching, but this stretching will be a type of stretching with excessive resistance and to passive stretch, and this will reduce the tension in the muscle temporarily. Now let's talk about fibrotic contracture. It is a permanent loss of extensible of soft tissue which occurs that cannot be reversed by non-surgical intervention. Here there may be fibrous changes in the connective tissue of the muscle or the surrounding periarticular structures. There will be eventual increase in range of motion, but the optimal tissue length will be very difficult to re-establish. There may be permanent loss of extensibility and can have a longer period of immobilization of the joint.
There are a number of reasons why contracture occurs. Some of them include paralysis, muscular atrophy, dystrophy, loss of strength, loss of muscle control, stiffness in tendons. So we'll talk about paralysis first. What is paralysis? This is basically loss of motor function in which the signals sent to the brain are interrupted due to damage to the nerves or neurons. This can be caused by a traumatic injury such as accidents. Then we have muscular atrophy. Muscular atrophy is also called muscle wastage. So basically, as you can see on the picture below, the normal muscle looks like that, while the atrophied muscle, it has lost a lot of bulk because it's become weak, and since it's become weak, it can no longer support the joints or the range of motion that is required for normal movement. Then we have muscular dystrophy. Muscular dystrophy, this is an inherited disease that damages and weakens muscles over time. It's usually due to a lack of protein called dystrophin, and it also limits the range of motion, and the patient is unable to perform any physical activities due to muscle dystrophy. And then loss of strength. Loss of strength is basic. The patient does not have the strength to perform the movement. They complain of pain while they're performing the movement. They don't have their strength to carry out the range of motion. Stiffness in tendon usually can occur after recent fracture, a bedridden lifestyle, sedentary lifestyle, as well as the patient is immobile. They cannot move around. This can cause stiffness in the tendon, and not just in the tendons. It can cause stiffness in muscles, stiffness around ligaments around the joint, which causes contracture to occur. Therapies of contracture include, first of all, we need to assess the patient either in sitting, lying, or standing position, depending on where the contracture is. So first we need to position the patient, and then we need to apply heat to the damaged area in order to assist with the pain and to reduce pain before stretching. If we will apply heat before stretching, when we apply heat modality to the muscles, this will lead to increase in blood flow, vasodilation, which will increase the blood flow, oxygen, and nutrients to the muscles. And this will help when we're stretching the muscle, as it will prevent pain and it will also improve the range of motion. Stretching, so when we're actually performing the stretch, it's pain-free for the patient, and we can use splints or casts for longer duration of stretch. Then we can also massage the affected area to maintain the tissue mobility and nutrition, as when we massage, the blood flow to that area will increase, hence increasing the nutrients and oxygen supply to that area as well. Then we have manual techniques such as mobilization. These are usually performed to reduce pain and to increase the joint flexibility and improve range of motion overall. And we can also use other orthotic devices such as the cast or something that the patient can wear throughout the day to help with the pain.
Thank you for watching physioworld. Please like, share, comment and subscribe to the channel. The next video will be about properties of tissue.